Yes. Hi.
Hi guys.
From a very bad voice, I'm going to let Dr. D speak today. We're going to be discussing various learning disorders.
So doesn't she look great today? In positive vibes? I think people...
And we're going to...
Yeah, we're going to discuss about
discuss all these things. So
okay, send her messages to show her love, to show her your love, and to say, you know, good words about her voice and stuff. She will love that. Okay?
Thank you so much. Stay tuned.
Yeah.
So that was gymnopedie, and we're going to move straight in. I'm going to put the microphone very close today because my voice is really not well. Luckily, we have a doctor in the studio.
Hi guys. Hi everybody.
And it's so nice to have Dr. D. This is how we know it's Dr. D.
That's perfect.
Dr. D discusses developmental pediatrics with Saskia Constantinou on Reg Classic.
So that's especially for you with the music. You said you liked Chopin.
Yeah, I love Chopin. I used to play Chopin. Yeah, I used to play the piano. Do you know I'm taking lessons?
Really? I didn't know that.
I'm taking piano lessons. I actually did a few years piano when I was a child.
Yes.
Okay, but actually my father stopped me because he said that's not a thing for boys. So now that I'm back and I'm 47 years old, okay, I'm taking lessons with a beautiful, an incredible music therapist, Nina Yeriou. She's incredible. You're gonna laugh. Actually, you should
we
have
need to have her on the program.
Yeah, and she's trained in the UK, so she'll fit incredibly. Okay.
It's funny that you say that. You know, there are so many musicians, medical people who are musicians, and musicians who became doctors as well because their parents didn't want them to be musicians. So they did medicine, but they went finally back to music.
Do you know, I wasn't supposed to be a doctor. I wanted to be a historian or a captain, a sea captain. Yeah.
I think I'm happy that you're a doctor because...
I will make a great sea captain.
And you're very good with kids, so you've chosen the right specialty as well.
I love kids. With the parents, it depends. I'm a very strict guy. You know?
You have to be strict.
Yeah. Not with the children.
No,
not with the children.
The parents are the ones who need.
Parents.
Yes. And today we're going to discuss learning disabilities. I learned there are three main categories. So I'd like to start with dyslexia.
Yeah, before we start,
yes.
I want to say something to everybody who's here and listening and who's seeing us live from Facebook and stuff, so that learning disabilities shouldn't be about stress. Okay?
Yes.
Shouldn't be about stress. Yeah. It's just have to know what it is and how it can hinder, okay? How it can be an obstacle, let's say, in our school readiness and stuff. But other than that, just keep it calm, keep it low, it's going to be fine, okay? Have to be happy.
Yes.
Remember what I told you, positive vibes, be happy all the time. Yes, you can do it. Pragmatic, but happy.
Yes, yes. If we go to the three basic categories, we've got dyslexia, dysgraphia, and dyscalculia.
Dyscalculia, yeah.
Okay.
And we've got a bunch of others we're going to talk about.
We'll talk about those as well.
Because as a developmental pediatrician,
yes.
Okay, I always have to see from the medical perspective.
Yes.
Okay, and follow the WHO, ICD-10, classification and stuff. So I'm going to speak on behalf of the doctors, let's say, side.
Of course.
Out view.
Of course.
Yeah.
So I want to ask, when are these learning disabilities first diagnosed?
So it depends on the definition, all right? A learning disability is let's say, I'm going to speak very plainly, okay? Let's say it's a problem that arises while a child has no physical disability, okay? So its IQ should be perfect, I mean age appropriate, normal IQ within the age appropriate range. okay, he doesn't have any physical disabilities or any other developmental disabilities like autism or global developmental delay. Okay, and basically he has problems in either retrieving the information, expressing the information, or storing the information. So that's a general outlook, okay, on what learning disabilities should be. Okay, so it depends on the child, okay, because sometimes learning disabilities, okay, can occur as a part of a larger frame of problems, okay. For example, I have a learning disability. I told you I play the piano, right?
Yes.
Although I do play the piano, okay, I'm dyspraxic, okay. Dyspraxic, it's a Greek word. It comes from the affix dys, which means difficult, okay, and praxis, which means action. So dyspraxia, okay, it refers to the lack or the difficulty in coordinations with the hands in this case, although it might involve the buccofacial muscles, okay, for which we're not talking about a learning disability anymore. We're talking about, okay, a problem with language. It's a language disorder in a way, okay, but we're going to talk about learning disabilities. And sometimes you say you have an awkward child, okay, you have 2 left feet, okay, a child that cannot dance, cannot play soccer, football, okay, and the things that I have, let's say, bad hands in a way, meaning that my hands cannot coordinate appropriately. They either cannot coordinate between themselves, so clapping hands could be a problem for these children,
yes,
okay, or playing the tennis or something like that. Or my fingers cannot coordinate properly, or my visual spatial ability, okay, that is to move, for example, in writing on a paper, can be also, let's say, diminished. Okay, so dyspraxia caused my dysgraphia. I write very poorly, okay?
But you're a doctor.
I'm a doctor, but I used to write that, I used to write like that ever since I was 3 years old. Okay. So actually my grandmother, my grandfather, they were school teachers and principals at the time. They were enlightened people, okay? And they actually saw that, okay? And they didn't fix it. They never attempted to fix it. Do you know that? Isn't it amazing?
This is what I want to ask you. When, because you mentioned tennis.
Yeah.
Now, the first time that I went to play tennis, you don't hit the ball the first time.
No, you brush the ball.
Yes, but you practice.
It's true.
How long is it between trying something new and
acquiring the ability
and saying, you know, and understandably that some people need much more practice than somebody
That's a beautiful
else.
question.
So where do we see, oh, I can't do it and I've got a problem?
Yeah, let's say how many attempts or how much time.
Yes,
So,
and especially with the piano.
Well, the piano wasn't a problem for me. Actually, I think I was very dedicated to the piano because I really liked it. Okay, I really liked it. So it wasn't a attention deficit, but I think I put a lot of effort in the piano because I really loved it. Okay.
So tell us when you actually realize, and you say there is maybe a problem, and at what sort of age?
So it's an incredible question. I will tell you because there's a lot of history behind that. And I do tell them that I have 6 degrees, okay, six diplomas. Okay, I'm not kidding. I have the medicine, the pediatrics, the developmental pediatrics. I have the PhD. I have also a degree in political sciences in the Middle East. Okay, and I speak a lot of languages, 17 languages. But I'm dyspraxic, so most of the tests I took were oral tests, and that was because at an early age I realized that I couldn't actually write very well. So, do you know when we take the test, the Pan-Cyprian test for the university exams?
Yes.
Okay, I was doing, the essay stuff. Okay, we were supposed to write an essay and stuff. I was very good in Greek, okay, and in English. But I had an incredible professor, Professor Karayanis. He was an ex-principal, and he was an amazing guy. And he realized that I couldn't write, and I was very apprehensive. I didn't do assignments. I didn't want to write. So he did the whole thing orally. He took me through the essay control and making and stuff like that. You know how to do an essay orally. And he had me for the whole year write only 4 times an essay. And when I took the exams, it was very difficult for me. And I will show you something. Here, okay, can you touch here, please?
I can see you have a hardening of the...
Yeah, it's a hardening. Actually, it's a muscle that is trained more than it should be. Okay, that's because when I hold... May I take the pen? Okay, when I hold the pen, okay...
You're unusually tight.
Yeah, I'm unusually tight. So it developed a very small muscle, okay, so that our listeners can understand, in the hand that actually shows, and it helped me, to keep, that I kept the pen very stable. Okay, the viewers can see that, but for the listeners, that means that, you know, I have to position very consciously the pen between the first 3 fingers. Yes. Okay.
They've really made a triangle for
okay, exactly. It's like doing the Orthodox cross, actually. So I have to position. Otherwise, my grip, my grasp is not the correct one. So I have to be very conscious when I position the pen in my hand. So in order to keep this position of the pen and to be able to write cursive writing with a handwriting, the consequence of handwriting that is very, it can be read at least. It's
legible.
Yes. Legible,
yes.
All right? Somebody can read it, okay? It's legible. So I had to put a lot of effort, and imagine writing an essay for 2 hours, okay? So I actually had pain in my fingers and my hands, and I had to stop in order to write. So that was in order to battle, okay, the dysgraphia. And believe me, when you have a learning disability and you go into higher education, and I want the listeners and the viewers to realize that you're faced with a great disparity.
Yes.
Okay?
Yes.
And people with learning disabilities have a lot to face. They have to face failure, success, okay? Have to face the system that is not cut out to be a system for people with disabilities in general. Okay, unless you go to the Anglo-Saxon countries like the US, the States that I love, the UK, and places like Holland, the Netherlands,
yes.
or Germany. These places are more ready than us. Okay, and so the point is that I knew from an early age that I had a problem with my hands. Okay, but I didn't actually realize it until I did developmental pediatrics. Okay, so in developmental pediatrics...
And I just want to go back and say that I think frequently we have to outline and make very clear that a learning disability or challenge, I think maybe I even prefer the word challenge in some cases,
because disability has a burden.
Yes, it has a burden, and it doesn't mean that the IQ level of that person is not okay, because you would have never got through pediatrics. And how did you get through your exams?
I opted for the oral exams instead of the written exams. Okay, but we're going to get to that.
Yes.
Usually most of the parents that bring their children to my office, to my clinic, okay, they don't come from learning disabilities. They come because they believe that either their child is retarded, mentally retarded, okay, either they believe that their child has short-term or long-term memory problems, or they think that, and this is the most frequent one, they think that their child, Saskia, has ADHD, attention deficit disorder. Why? Because they think that their child cannot attend, cannot listen, cannot focus on what the teacher is saying, whereas it's a processing disorder. The child cannot process easily, but this is something that the listeners and the viewers have to realize, is that although it seems that the processing, okay, in other cases might be attributed to, let's say, a retardation, In this case, you see that it is not. So how do we differentiate that? You can see a child that knows how to do stuff, knows how to do a cake, knows how to build a furniture from IKEA, from scratch or something like that, but he cannot read and write. So it doesn't add up. I mean, you see the difference, the disparity, because you see the difference between abilities. Whereas if you have a global developmental delay, okay, usually, not always, okay, I'm just doing the broad spectrum here.
Yes.
Okay, usually the child is even, okay, in 2 or more domains, okay, which means that if he's retarded, his speech is going to be back, his let's say his gross and fine motor skills are going to be delayed, etc., etc. So it's a different view for a specialized doctor, okay, and the only one who can actually put diagnosis should be a doctor, okay. This is why am I saying this? Because in order to focus on what we call developmental learning disabilities, you have to exclude the developmental disabilities. Okay, and this is very important, Saskia. We're going to talk about the learning disabilities, but being a doctor, have to focus first on the senses, meaning that you have to check the child if he can see well, if he can hear well.
Yes.
Before you say it's an auditory, let's say, processing disorder, you have to be very careful to see if a child hears. Do you know that I get a lot of children that cannot hear all the frequencies? Because parents are aware of this, okay, we have very intelligent parents, especially in Cyprus, very well educated, okay, etc., etc. So usually the problem, okay, is that a child might have an otitis media, okay, so he might be hard of hearing, but not in the whole spectrum of frequencies.
Yes.
He might not hear, for example, you might have, for example, if you have jaundice might, I'm going to speak very plainly, might burn the high frequencies, okay? So if you have jaundice at a very young age, but a jaundice that is over 18 to 20, that's why you do, or meningitis, that's why you do an audiogram afterwards, okay? And that's why you have to consult with your ENT, okay? Ear, nose, throat specialist, etc. Why? Because he has to perform very specialized, okay, tests in order to see if the way a child can hear, okay, can listen, okay, or if the nerves that concern the auditory processing are well, okay, because some of the children are delayed because of that. It doesn't have to do with developmental, with learning disabilities, rather with developmental disabilities. Also, if you have let's say a problem with sight, okay, if you cannot see well, but this is something that is very rarely missed, okay.
Yes.
Sight, you can visit an ophthalmologist and you have to perform, okay, a test as well for the visual acuity, okay. So Saskia, the whole thing is that you have to check hearing, okay, and sight, okay, eyesight. These are the two things that are most important because for example, dyslexia, okay, let's say the English definition is that it has to be 2 years below the average school performance, which means that if you're according to the Greek Cypriot, let's say, curriculum,
yes,
okay, I'm not talking about the British or the American, it's different. Okay, when he's at the end of the 2nd grade or the beginning of the 3rd grade, you can see that he or she can write and read, okay, as he were a first grader.
First grade.
Yeah.
Would this not be picked up from nursery school when children are 5 and they're supposed to be able to write their name before they go to primary school?
That's a very good question. Actually, I tried to answer what you said about the ability that it has to be built up. So during nursery school, you might be aware, okay? You might see, or in Greek miristo, you might sniff
yes,
that something's not going well, but that might be just because a child needs more repetition. So we say, take your time. We're going to put you in a high-risk group, okay, and see a couple of stuff, okay, watch, control, okay, observe, okay, and then we'll see, okay, whether you fall under the high-risk category for early learning disabilities. But I want to, give me 1 second please. Okay, I want to make very clear that you have the developmental abilities, which is the gross motor ability, which means that it's your feet, your legs, your balance, okay? So if you have dyspraxia, that might also be affected. Okay, dyspraxia, lack of coordination. So that child maybe he cannot play soccer, maybe he cannot kick the ball, maybe he cannot balance well, he cannot dance well. So that's also learning disability if you see it from the sports perspective.
Yes.
Okay, and then you have also fine motor skills, which is the hands. Okay, and you might have the piano if it's music. You might have the writing, which might be called dysgraphia. Okay, so dysgraphia is the difficulty in writing. Okay, so when you write, okay, in cursive, okay, that's a very difficult thing. Okay, because you might have difficulty in writing because your hands don't coordinate well in the writing, don't follow the sequences. But you might also have dysgraphia, Saskia, and this is very interesting. I want you to hear this, okay, and the listeners very carefully. You might also have dysgraphia, Saskia, because of dyslexia. So dysgraphia because of dyslexia is not the same as dysgraphia because of dyspraxia. So if you have, listen to this, and I want everybody to be very careful on this. If you have dysgraphia because of fine motor skills, it's going to be, the child is going to write badly either in copying, okay, or in dictation. Okay, whether he copies antigraphy or he's being dictated orthographia, it's going to be the same, okay, because his fine motor skill, okay, is problematic, has a lot of problems in actually forming and following the sequence of the writing the letters. But if you have dyslexia, usually, okay, as a rule, usually there are exclusions, but very few. Okay, you have problems also in which area? You have problems only in dictation, but you don't have problems in copying because he can follow that. Okay, usually.
Reading is of course a very complex process.
Yes.
Where you have to extract meaning from written symbols, but in today's world it's really the most important way to access information, and so literacy is sort of a prerequisite for success. People who have dyslexia also frequently complain about dizziness, about headaches, about physical difficulties that they have, stomach ache. They lack the sort of perception and peripheral vision. How can this be addressed, and what, in your opinion, is the best way to rectify it? Is it possible to fix or to improve?
Dyslexia, yes.
Yes.
And the reading ability, yes. It's not going to be easy, but yes. But first of all, let's go to the dizziness part, okay? When a child comes to me, I always refer to an ophthalmologist.
Yes.
Okay, and if he wears glasses, if he or she wears glasses, he must wear the glasses. He or she must wear the glasses during the examination. Okay, and usually what we see is that children with eyesight problems, okay, ophthalmological problems, have a hard time focusing on, like in astigmatism, for example, have a hard time focusing on the text, and that's pretty normal, isn't it? So he might have dizziness because of that. So if it's not an eyesight problem, okay, the ophthalmologist has given us a thumbs up, so dizziness might be also a psychosomatic thing, because they realize that they fail, okay, in reading. Okay, so psychosomatic health is very important. It's something that we as doctors usually don't listen to. Okay, we dismiss psychosomatic problems because we don't consider them usually as an actual problem, whereas according to my opinion, according to my view, you should focus on the psychosomatic problems. You should focus on the reasoning, on the root of the problem.
Yes.
Okay, so dizziness I don't think is usually a problem of the peripheral eyesight, okay, in this case, but rather a sign that somebody is struggling. And when you have a learning disability, you struggle. So you have the auditory processing and you have the visual processing. So you see the letters. What are the letters, Saskia? The letters are symbols, okay? And you know, I work also in the States. I'm responsible for autism programs there, and I did my postdoctoral studies, okay, in observation in Yale, and was also sent in Harvard as an observer. So I had a child there, okay, patient, who was American Chinese, okay? So this child was dyslexic in English, but he wasn't dyslexic. I speak a bit of Chinese.
I'm glad you brought that up, because I was going to ask...
he was not dyslexic in Chinese.
Is it when it's a child maybe studying, 2 or 3 different languages?
No, it's not a problem. Actually, my PhD was psychosocial child development in a transcultural environment. Okay, one of the findings 10 years ago, okay, in my PhD in 2009, okay, 2007, sorry, was that a child can learn up to 4 languages simultaneously with no problem. It's bilingualism and stuff is a myth that it actually delays language production and development.
Okay.
And actually,
tell us about
and actually, you have to focus on the maternal language. So if you have a child that is, let's say, Italian, the mother is Italian, and he's in Cyprus where we speak Greek, English, and Turkish. Okay, so actually, you should focus on the Italian language instead of because the host country language, he's going to learn it, but the structure of the language, okay, should be the mother language, the maternal language.
Right.
So we focus always on the maternal language, and this is an evidence-based fact. I always go by numbers.
Right.
Okay, the listeners and the viewers should remember this. I always go by numbers, and behavior development is numbers. Although you might know.
I interrupted you. Tell us about the Chinese.
American Chinese, yeah. So this little guy, he was incredibly smart, okay? We did a whisk test on him. We did an IQ test on him, okay? And he was dyslexic in English, but he wasn't dyslexic in Chinese. So if you go into Chinese language, you'll see that they're using ideograms, okay? Like pictograms.
Yes.
They're using pictures as letters, and they're very comprehensive, okay? I mean, it's, for example, you have the figure of a lady, okay, like 2 lines, and that's actually the figure of a lady, okay? I mean, you have the fire that it's burning under a stove, that's fire. You have the rain on a window, that's called rain. I mean, 4 dots in a window, okay? So basically, it's a very easy language. Chinese is very easy. So he was dyslexic in English because the symbols, okay, don't mean anything right away in English or in Greek or any other language.
In Chinese.
But in Chinese, because they were actually, the brain realizes that these are pictures, okay. So, but in Chinese, he was fine because he was seeing the words as pictures, so he had no problem with that. So he could relate immediately the meaning of the pictures into words. But in our case, in the Greco-Latin, Anglo-Saxon vocabulary and let's say languages, written languages, we're using a sequence, okay, of symbols that we call letters, and the accumulation of the conglomeration of these symbols is translated or connected, okay, to the meaning of words. So you have a circle, and this is very interesting, okay, you have circle, vertical line, you have the slashes and stuff. So if you take the basic, let's say, geometrical schemes, okay, like the triangle, and the circle, and stuff. You can create the basic letters, true?
Yes.
You have the triangle.
Yes.
The triangle is the letter D, for example, in Greek, okay, but it's also the letter A, if you put a line. Is that correct?
Yes.
Or in Greek, it's also the letter L. So if you don't recognize well, okay, in preschool, the geometrical schemes, the geometrical drawings, then you have a problem, okay, in realizing the actual letters. So that's a fair test that you could take when you have a preschooler that doesn't recognize. And a preschooler that doesn't recognize this, the geometry, let's say, doesn't mean that he's retarded. You should check the vision, and if the vision, the eyesight is correct, has no problem, then you should, put him in a high-risk observation group. Okay.
It's quite a complex subject, but I want to go also to touch a little on ADHD, because
I'm going to get back to the dyslexia.
Yes, and just the link in how your Chinese patient was able to look at the symbols and that they had meaning. The same with ADHD, that you find that they can actually do things that they're really interested in, and they have a certain concentration level for things that they're very interested in. Are you in agreement with that and some of the things that really...
I'm always in agreement with you. That's the important thing. But let me tell you something, okay? And then we'll get back to dyslexia because I want to take it in a very organized fashion. So, when you have ADHD, it's attention deficit and hyperactivity disorder. Okay, you can also have it as a comorbidity together with impulsivity.
Yes.
Okay, so when you're talking about ADHD, okay, and this also falls under the learning disorders, learning disabilities. Why? Because it actually inhibits a child from learning. Okay, but I'm very apprehensive, I'm very concerned whether all these diagnoses are correctly made in a lot of cases. I mean, it's actually very trendy to have ADHD. It was very trendy, at least in the previous years. So I want to talk...
And medication? Straight on to Ritalin or to Concerta?
Well, no, don't talk about medication, okay, or with names. But the whole thing is that I'm not against or pro-medication. I'm pro-proper therapy. Okay, but I want to talk about percentages. So, learning disabilities is about 12 to 15% of the general school population. Okay, we're talking about children that have been identified within their school years. Okay,
yes.
Can go from elementary school to high school. Okay, and that can follow you well into your adult years and higher education if you reach higher education. So, if you have dyslexia is supposed to be around 6% of the general population, and of which 3% is a serious type of dyslexia. Okay, it can be varied. Okay, but I have to say this: when you have attention deficit and hyperactivity, okay, these are two different disorders, actually, or can be combined. You can have ADHD or ADD. Attention deficit disorder or attention deficit hyperactivity disorder. So, which one of the two, the attention deficit or the hyperactivity, do you think goes relatively undiagnosed? One of the two.
The ADD.
Yes, you're absolutely right. Because the attention deficit disorder is going to be a child sitting in the back or near a window or near a door, okay, watching outside. He's going to be very silent. He's going to be in his own world. And the teacher, understandably, okay, I mean, I don't blame the teachers. I come from a teacher's family, okay, and a doctor's family. So basically, a teacher who has 25 children, he has an average of 1.5 minutes to 2 minutes per child during his school time. Okay, the period time, the sessions.
Yes.
Okay, he has. So understandably, he cannot, let's say, devote more time than that. So a child that goes largely unnoticed doesn't actually bother the class. okay, or the learning procedure. But if you have a child who is hyperactive, and maybe he's doing some naughty stuff in the classroom, then of course he's going to be noticed. So if you have a hyperactive child, that's a cry for help usually. But it doesn't mean that he has ADHD, okay? But if you see a silent child, I'll be more concerned. Okay, silent child is always something that should concern you more than a screaming child. I say the first thing that they taught us in medical school, okay, in the University of Crewe, one of the 10 best in Europe, okay, was that when you approach an accident scene, don't go immediately to the ones who are screaming. Go to the ones who are not screaming. They are in more need than the ones who cry out for help.
Yes.
So it's the same. It goes to say that it is the same for the children who have ADD. So an attention deficit or any other learning disability is a disability that persists, and this is very important for the ADHD, okay, for more than 6 months. So it's a trait, it's not a state. What do we mean by that for the listeners? When you have a trait, it's a permanent feature of yourself.
Yes.
When you have a state, it can be something transient, parodiko, transient. It can be something that is temporary. Okay? So if you have something that is transient, it will go away. If you have a divorce or a death of a loved one in the family, that's something that will, of course, influence the child, but for a certain period of time. Okay? And it will understandably influence the child.
Why?
So if you have attention deficit disorder that is caused by something like that, it's going to go away with the proper help. But attention deficit disorder, first of all, okay, is a child that cannot attend, okay, although he might be interested. If you have hyperactivity, it goes for the same. You see children that cannot sit still,
Yes.
okay, but sitting still doesn't mean that he has attention deficit.
No.
Okay, he's just fidgeting. So you hear a lot of children that are, okay, they're hyper, but they know what the teacher is talking about. So the consequence of either attention deficit or hyperactivity or impulsivity, okay, should be that it interferes with the general learning functions regarding the learning disabilities. Okay, because it does a lot of other stuff too. So if you have an ADHD, okay, you should be, yes, if the viewers or the listeners have questions, we welcome them.
Yes, yes.
Okay, that would be more interesting, I think. So if you have attention deficit, okay, the thing is that the child has to be trained, okay, and it is not something that the parent can do by itself. So he might have poor grades, he might feel low self-esteem, and he might seem sad, or there's a very nice Greek word, it's called etherovamon, he's flying into the air. He's a dreamer, he dreams, daydreaming. Actually, that's another translation,
Yes.
okay, in English. So he's a daydreamer, he's drifting, okay, but aside from that, he's fine, okay. So, and yes, please go on.
Why is it that medication is prescribed so often?
Well, let me put it like this: 8 to 10 children in the States are medicated. Okay, when you have a diagnosis.
Are
First
you
of all-
referring to ADHD
Yes, to
or
ADHD.
in general?
No, we're talking
Okay.
about ADHD.
Okay.
Let's keep it in
Okay.
small boxes today. And when you have ADHD, 8 to 10 children are medicated, but it's a different perspective, okay, rather than the European one or the Cypriot one, let's say, and I will explain this. Okay, personally, I very rarely medicate children, okay, and I do this very rarely because there are a number of other ways that you should consume, let's say, okay, or deliver or prescribe before you prescribe drugs. But I'm not against drugs. So the perspective in the States, and I agree with that in a big manner, let's say a big percentage, is that when you prescribe treatment, medical treatment, which is drugs, okay, it's different than the psychological or the special education treatment. It's for the child to open a window, okay, in order to receive the educational psychological treatment easier, and that this treatment should have a bigger effect, okay. But the ways, let's say, we treat ADHD and or other learning disabilities in the States, it's quite different than what we do here.
Why is that?
Well, you know why. Okay, it's the way we drive in Cyprus. Okay, it's a lot of road rage. Okay, so basically, it does have something to do with driving too. We have very low visual and spatial abilities. Just kidding. But the whole thing is that, for example, I have dysgraphia, okay, which is attributed to dyspraxia because my fine motor skills are very low. Is this true? Okay. And imagine, I did perform surgical operations.
I was going to ask.
Yes, but I was very good at it. Okay. Okay, I also did a great number of invasive procedures in children when I was doing my residency, and I was very good at it. I'm very selfish about that. I have to brag about this, but it doesn't mean it was easy for me. Okay, and I was the best in drawing blood. Okay, with no pain or nothing, but I was very, very focused. It actually demanded a 40% more of, let's say, we say kopos in Greece.
Yes.
Okay, we say of effort. Okay,
yes.
but it's different. It was kopos is also a burden. It's also something that it shows that you need to press more. Okay, so it demanded 40% more of an effort. Okay. In comparison, okay, to somebody who didn't have dyspraxia. So, in the States, nobody cares about writing anymore. Okay, at least in the East and the West Coast, in the Bible zone, within the Midwest and stuff like that, they do care. Okay, because each state, each small country, let's say, within the country, okay, just to give the notion, it has its own rules. Okay. But in generally speaking, for example, we don't care about handwriting. Why? Because nobody uses it anymore. And I know this is radical, okay, for the Cypriot mentality and conception, but actually it's not going to be useful in 10, 20 years in Cyprus either. So when schoolers and preschoolers in the States have the option to go directly to an iPad, to a tablet, to a laptop and stuff, so, and actually I tell the parents, how often do you write? Okay? How often do you write? You know, the only thing I write nowadays for the last 10 years is my receipts. You know why? Okay? Because everything else, I write it on my iPhone, okay? On your phone, on your tablet, on your iPad, on your laptop. Why? Because it's not going to be legible if I write it by hand. You know? So basically, writing is an art form. It's not disappearing, it's not going to disappear, but it's not going to be functional. So that's why we think in a very different perspective. But in order to medicate, there are very fine rules. First of all, we medicate if a child, for example, is impulsive and dangerous, okay, to itself or to others. Okay, which can be a big problem. If you have hyperactivity together with impulse, okay, then you have a big problem, because usually these children will have delinquent behavior when they grow older, especially during teenage years, and especially if they come from a low psychosocial and social, let's say, background. Okay. So, especially in the States where, you know, things are difficult sometimes, okay, especially if you don't have the money or the insurance. So, we medicate because the structure of assistance to the families, okay, is such that can help the already existing sources of assistance, let's say the special educator staff, do its work better, okay, but it's not the same as the European perspective where they medicate, usually in order just to get rid of the symptoms, okay, to cut the edge, let's say. Yes?
Is there a link to LPD, language processing disorder?
So, we call it usually, if it's, and I think we're talking about the same thing, specific language, specific language impairment. So, specific language impairment is the inability to master written or spoken language, although the IQ falls into age-appropriate limits.
Yes.
Okay, so this is also something very important and very frequent. I see it in my clinic, Saskia, all the time. Okay, about 12%, 10 to 12%. And it does begin with a speech delay, okay, because the child cannot comprehend usually very well the words that he or she hears, and cannot express accordingly. Okay, so for example, there might be, as well as in dyslexia, he might use substitutions. Instead of house, he might say home. Okay, or he might use relevant within context words, but not appropriate.
Right.
Okay, okay. For example, if you want to say the air conditioning. Okay, he could be more descriptive. The machine that makes cold. Actually, I had a child that said it in English like that. Right. The machine that makes cold. It's correct, isn't it? Or the cold machine.
Well, not really.
Exactly. It's within context, but it's not exactly correct. But it gives you the meaning. Okay. So, for example, my favorite, let's say, example to my students is when I teach them developmental pediatrics is this. So you have somebody that tells you, Dimitris, give me the water, okay? And I tell them, okay, have the coffee, and I give them the water. So actually, I processed the command correctly. You ask for the water, I'm giving you the water, correct? But what I'm saying is different. So the command is processed correctly. Dimitris, give me the water, and I give them the water. But instead of saying, here, take your water, take a glass of water, I tell them, take a glass of coffee. So it's relevant, fluid, but it's not correct. So this is a big attribute, it's big cause for being referred to me, and usually for mental retardation, because the parents think that the child is retarded. But as parents become more aware of learning disabilities or more aware of developmental disabilities, I see children in an earlier stage of their life, and they come for a speech delay. Okay, so a speech delay, which is very frequent, can be up to 20 to 30% of children, okay, can evolve is the right word, into a specific language impairment. And I will see that in the way they use the verbs, they use the pronouns, they use the adjectives. Okay, usually these children have a problem in expressing cause and effect, liaisons, therefore, because, okay, before, after, they have a problem in sequencing. So specific language impairment, okay, actually is a very confusing, okay, thing for parents and specialists alike, okay. So, and usually it's done by exclusion of the previous, okay, causes. So, yes, please go on, Saskia.
I also want to ask about all these tests. So, for example, VMI, the developmental test of visual motor integration. Who and many others that you use. Yes. Who actually performs these tests? What type of doctor performs these tests, and who actually analyzes them?
Well, it's a very big question. Okay, first of all, the problem is that usually, unfortunately, we don't have standardized tests for the Greek Cypriot population, neither for the Turkish Cypriot population, mind you. Okay, so these tests do exist, but very few of them are standardized for our population. That
Right,
means
do you need, so
it doesn't mean that what we use in the States applies here.
is that because of the language differences?
It's because of the market, my dear. We don't have a big market in order to standardize. Standardization costs a lot. Might cost from 10 to 100,000 euros.
What about the tests used in Greece? If you're using
Very
tests?
very few are standardized. Okay, and they can exist as tests, but standardized tests, which means that they're verified, that they apply, very few. Okay, yes, don't be surprised.
I am surprised.
No, you can actually, I always say that if I use, for example, the VMI, etc., okay, in some cases, these tests that we use, because they refer to development, okay, they are universally the same, sometimes. And when I also want to place an example to my students, I say to them, until 3 decades ago, 3 decades ago, you know the curves, the growth curves,
Yes.
okay, in the Vibliario years, in the health booklet,
Yes.
okay, we were using, in Greece especially, the Swiss curves, growth curves. The percentiles, okay, so I imagine that the Swiss people are taller than us.
Yes,
So, you understand?
I understand.
So the percentage, okay, so
Is this leading to a lack of diagnosis, of correct diagnoses?
first
you
of all,
think
let me tell you, in Cyprus we're only 3 developmental pediatricians. We're 2 Greek Cypriots. I was the first to come in 2007. Okay, and then Dr. Christofi, who's a brilliant also developmental pediatrician in Limos. I haven't known him personally, but I know his work. And also Dr. Dogan is a Turkish pediatrician. She's a fabulous developmental pediatrician, married to a pediatrician, a Turkish pediatrician from Paphos. She was actually trained by a friend of mine from Yale, Elgin.
Wow.
She's now in Izmir. So we're only 3 developmental pediatricians on the island. Okay, so that means that as far as doctors are concerned, who are the only capable of doing a diagnosis,
Yes,
putting their signature on what the child has.
yes,
Okay, there are very few of us.
yes,
Okay, and this is very important. Okay, and the time I spent, for example, 2 weeks in Cyprus, and then the rest of I have my basis in Cyprus now. Okay, for 2 weeks I'm here, Nicosia, and the rest of the 2 weeks I'm in the States, or I don't know, Middle East, or Turkey, you name it. I'm everywhere in the world. Okay, I was in El Salvador. Okay, the week before, Mexico and New York. So basically, there are very few of us, and I hope that in the near future, okay, in the near future is from anywhere from 5 to 10 years, we'll have more developmental pediatricians. There is work for everybody.
really important.
So let me tell you something. And this is very, very interesting, let's say, for the listeners, that in the States, a clinical psychologist with a PhD can perform certain diagnoses. I have my friend Dimitra Robokos. She's in Columbia University, and she's in the Rose Kennedy Rehabilitation Centers, if I remember correctly, in the Albert Einstein College of Medicine. Okay, she's also performing diagnosis, but she has a PhD. Okay, so and there are a couple of diagnoses that you can get services for, but I'm talking about the States, I'm not talking about Cyprus.
Yes.
If you get an evaluation, that is an educational evaluation, so you can get services without going through a doctor, but you get school services. Okay? But the problem with this is that there is no medical factor. Every time you have a learning disability, you have to be concerned whether there is an underlying medical problem, because let me tell you something. I want the listeners to be very precise about this. It's very seldom that I see children with short or long-term memory problems. It's a myth that we have a lot of children with memory problems. We usually see problems with memory, short or long-term, in children with cancer, with brain tumors. Okay, that's where I usually see children with memory problems. The memory problems that seem to arise in learning disabilities are usually secondary problems because they have processing problems. It's not because the memory is affected. It's because they cannot store it, because they cannot understand the symbols. Yes. You have a word. If the child cannot differentiate, the symbols between them, it's not because he cannot remember them. It's because he has problems in realizing what the symbols mean by themselves or in conjunction. That means all of them together.
When we come to dyscalculia,
yes,
with mathematics, I'm wondering how you tell that a child actually just can't manage, or whether the teacher is actually
liable.
And I'm wondering how it's different from the pathology of maths anxiety.
Well, let me tell you something. I had the same question a few years ago, 5-6 years ago, and I was in Yale. We were doing a course on learning disabilities, and I actually asked the same question. And there is a kind of a new knowledge, This new knowledge is about 6-7 years old, is that you can tell dyscalculia, which is the problem in math,
yes,
when a child is around 3 years old. Isn't that amazing?
Yes.
But Saskia, he cannot read or write, or he cannot count actually when he's 3. What do you think? Is that appropriate? I mean, is that normal that I say that?
To be able to do maths.
No. I mean, what do you think I'm saying? I mean, they said to me, they proved it, that a child can be assessed and put in a high-risk group from the age of 3. So let me tell you this. I was thinking that a child can count after he learns how to count. And then the parents go and they say, but Dr. Dimitris, Dr. Dimitriou, my child can count. He can count ever since he was 1 year old. 1 year old, sorry. And I said to them, no, he's not counting, he's reciting Apangeli, then metrai. What do you mean? So, counting, and it is beautiful, perspective in this. I like because you can see in developmental pediatrics you have the ability to see how the brain works. But from a medical perspective, not from a psychological perspective. You see how the brain functions. It's beautiful.
Yes.
So you have a child that says 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. About 1 year old. That's reciting Apangelia like a poem. He's reciting a poem.
Yes.
He doesn't really understand what is counting.
Parrots do that too.
Yes, but what is counting? Counting is the accumulation of things.
Yes.
Is when you have a mass, when you have a lot of things together. That is, for example, you have 3-4 pens. You have 3-4 pens, 3-4 cubes. When he sees the cubes, he's going to say, and you ask him how many they are. He's 1 year old. 1 year old. He will say, I have 4 cubes. Very few children will say that. And these children are usually gifted. But he can count 1, 2, 3, 4 cubes.
Yes.
So that is also reciting 1, 2, 3, 4. So counting, listen to this, Saskia, counting is different than reciting. So studies have found and experiments have shown that a child, I didn't know this 6 years ago, a child has the innate ability, την εγγενή ικανότητα, within, the ability from within, the innate ability to realize what? To realize the number up to 3 from the age of 3 to 4 years old, without being able to count. Isn't that amazing?
Yes.
Yes. So we have a mathematical ability built within ourselves. And I didn't know that. I thought that the mathematical ability was at large, let's say, acquired, which is not. So what do? You see that if a child realizes that these are 3, okay, have no problem, okay, 1, 2, 3. You can teach him about 1, 2, 3. He's able to count, okay, and you can subtract or add, okay, up to 3, 4, okay, and he can realize whether something is missing or not from that accumulation, that mass accumulation of 3 or 4 cubes or pens or whatever. Whereas children who don't have this ability usually would develop mathematical, let's say, disability, dyscalculia, okay, in the near future. Okay, you will see that. It's also a problem of sequence. A sequence is the series of things. When you put things, okay, in a row, 1, 2, 3, 4. So you can see that children cannot go back and forth, okay, during a series of things, okay. And when you ask them also about something that happened before and something that's going to happen afterwards, or about days of the week, usually they have problems. They confuse the days, they confuse the months, they confuse the time, they confuse the time. Let's say gerunds, or you say, for example, tomorrow afternoon. Okay, yes, please go on.
Is that less possible to fix than dyslexia?
Well,
is it a more serious learning
very interesting
disability?
question. Usually, dyscalculia doesn't come in on its own. It comes with conjunction. It's comorbid, and with the principal culprit, which is dyslexia. Dyslexia can be associated comorbidity with ADHD, with anxiety also. It can also be associated with dyscalculia, dysgraphia, okay, and you have a lot of stuff going on. So you need somebody who is experienced in this, okay, because usually you don't deal only with one aspect, okay. So imagine the letters. Okay, not the Chinese letters.
Yes.
Okay, imagine the Greek or the Latin or the English letters. So what do you have? You have a sequence of letters. So usually you have, let's say, inversions. Okay, you have also, let's say, okay, you might have substitutions. Home, house. You might have inversions. Might have, for example, you have left. Okay. And you have felt. So you have the change of the letters. Yes. One goes, one falls into the place of the other. Okay, so in these cases, what's the problem? Okay, in this case, it's a problem of sequencing. Okay, felt, left. You see the difference?
Yes.
Okay, so that's also a mathematical thing, because sequencing, okay, is a mathematical value. Yes. What do you think?
I think that the people have to go to the specialist, and they have to get professional help and not do their own diagnoses.
Exactly. But let me tell you something that is very interesting for you. I believe a lot in music. Music and music therapy. Okay. I play the piano. Okay. So there is a lot of mathematics in the piano.
Of course.
You have to keep with the rhythm, you have to count. I'm very bad in using my fingers, and Nina always tells me, okay, Dimitris, you forgot your first finger, you have 5 fingers, not 4, okay? I tell her, I can't do that. I mean, I cannot use my fingers properly, okay? But the more experience you get in piano,
yes,
okay? So, but actually, using my fingers is also a sequence. But I have to follow the sequence. For example, when I play Mozart, that Mozart actually wrote. So Mozart wrote a sequence, a mathematical sequence. Okay. So what do you think,
This
Saskia?
is a whole other discussion, and the same goes for Bach, where all his music was mathematically thought out.
Exactly. So if you use music can help you in the rhythm, can help you in following sequencing, can help you in counting.
It
and
also
can be
helps
also
to balance someone when you get really agitated.
Yes, it does.
It's been fascinating talking to you. Unfortunately, our time has come to an end. So
already?
Yes, very quickly. We've been speaking for over an hour.
Kidding me?
So very quickly, I have to use your expertise as being trained in infectious diseases, and in closing,
yes,
I have to talk about...
This is something I want to tell to listeners. For 2.5 years, I used to be in Maca, in Pedon Hagia Sophia in Athens, in the Department of Infectious Diseases, and I loved it. If I wasn't going to be a developmental pediatrician, okay, as I am now, I would have been an infectious disease specialist.
So, COVID-19, also known as corona.
I think it's a mass hysteria, what we're going through. Okay, we should just bear in mind basic prophylaxis.
Yeah, that's what I wanted to ask
you.
Tell us about the basic protective measures.
No, I'm going to tell you about my plane ride
the
here.
Hysteria of not having masks, whereas people don't actually even put their masks on properly. There's a way to put on your mask.
Look, I mean, we have the flu. We have a lot of other causes. People die from a lot of other things. I mean, it seems that the news is overreacting to this. Okay? I mean, there is a pandemic of flu. True? Every year.
Yes.
Do you hear about that in the news?
We do.
Very few. You don't hear about the pandemic, you hear about the endemic. You don't hear about that it's going globally.
No.
Okay, so basically this is something. It's going to go away as it went before. But it's a kind of hysteria. I mean, planes get cancelled. Half of the people on the plane were wearing masks. And if somebody calls, they're looking to him, you know, ask his, I don't know, he's a culprit or something. He's guilty of something. I mean, we should be quite careful, because there were also some incidents when I was in the States. I mean, I just came the day before, okay, 2 days ago.
Yes.
Okay, and that of racism, I guess Chinese people, okay, and Koreans, because they couldn't figure out what they were. Okay, okay, but I mean, it was, I mean, it's crazy. Do you know that the restaurants in New York, Chinese restaurants in New York, have a big problem these few days? Okay, and they're actually doing fundraising and stuff and organizing, because people don't go to the restaurants. The restaurants and Chinese restaurants have nothing to do. I mean, it doesn't make any sense. Okay, just basic prophylaxis. I mean, what do you do when you have a cold? Just be careful. I mean, I don't think anybody lets anyone else to sneeze into their face. Okay, just keep your tissues and stuff. And
isn't it because there's also it spreads so easily? A common cold one has a
common cold also spreads very easily. Okay, it's I was reading some statistics, and statistics might change. Okay,
yes.
Understandable. This is understandable. Okay, that it's in the common cold, let's say, which is not so cold. It's not one strain, or it's not only one virus. Okay,
yes.
Can be infectious in 1.3 people. Okay, whereas this can be infectious up to 3. Okay, so it does seem to be more infectious, but actually this is something that we realize because we follow through the news. Okay, it seems that the vulnerable groups that were always vulnerable, okay, still go on strong. I mean, also now vulnerable, like older people, people with, okay, major issues like cardiopulmonary problems, etc. Of what I've read, usually children under 9 don't have a big problem, okay? But it doesn't specify whether they're contagious to others. So I would say that keep it calm, keep it strong. I mean, don't go into panic.
Do you think that that's part of the problem, that people have actually started to panic, and this is because of the news and media?
Look, I'm a doctor. I have to go with the data. Okay, when people say, when I hear in the news, oh, it's been there are tens of thousands of sick people, and then you hear how many are dead. Okay, I say, oh, good. Why do you think? Because if there are a lot of thousands of people that get sick, but the dead are relatively low, that means that the mortality rate is low.
Yes.
So it does. When I hear the news, I interpret them very differently than the average person that will hear that you have 80,000, let's say, sick people, and 2,000 dead. I'm just saying, I don't remember the numbers.
Yes,
okay?
yes, are they continually changing?
Yes, exactly. It doesn't. This is off the record because I cannot, see whether this is true or not. Messages coming in. Okay, so basically what I'm saying is that if the numbers of sick people, are high, but the mortality, the people that are dying is low, that means that the mortality rate is low, and we should treat it more like a common flu, let's say.
Yes.
But it seems that especially in developed countries, it seems that they are losing a lot of work days. So work days are a big problem financially, because China has closed down its borders.
Yes.
We have a big problem regarding that. The other thing is that maybe, but this is a theory that I have read, and also some facts from WHO, and the CDC, they are concerned for this not to spread. Listen to this, Saskia, this is very important.
Yes.
This not to spread into third world countries, because then the mortality rate will go up.
We've already had that as of yesterday. We've got now in Algeria, Austria, Croatia, and Switzerland.
Well, if you go to Algeria, unfortunately I know Algeria, and I'm training for the Middle East, all right? So basically Algeria, if it spreads further down to Africa, and then we'll have problem, because the conditions there are not...
hygiene conditions are not...
are not optimal. I mean, but look, the rate of mortality of other illnesses, especially in the third world, is tremendous. I mean, we're concerned about something that understandably causes fright and stuff, but we're in the developed world. That's why it's frightening us. If you go to Africa, I was in El Salvador. You know El Salvador? It's Central America. People there are so immensely poor that, for example, Cypriots here cannot even imagine the circumstances, the situations under which these people are living. So I think we're frightened because we're cut off many of the diseases that were affecting us. I'm not underappreciating, let's say, the fact of what's going on now. But I think this is too much. Yes. And this is largely attributed, to the TV. Why should the mask, go on? Listen, if somebody's going to get sick, they're going to get sick. But follow the basic rules. If you're sick, stay at your home. This is basic. Don't sneeze towards somebody else. Do the vampire smile, slunk. Yes. And use a basic sanitizer. I felt
badly that I was at work today because I don't know, I'm not well. Yesterday I wasn't well.
Let me tell you something.
I understand why people are going to work, and it's wrong. I don't have corona, but yes.
You don't have corona, but let me tell you something. My motto is I want everybody to be happy. You know that. Yes. I want positive vibes. I want people to be smiling, but I want people to be rational.
Yes.
So I was reading this Facebook post of a friend of mine, and he said that, he's in Greece, not here. He said that in the emergency room, there came this patient. He said that, oh my God, I've got fever. How much fever do you have? Do you have corona? Do you need a test? He had 37.8. He told him, that's not fever.
No.
And then somebody else said that, my mother came with a child. The child was 32 years old, of course. And said that, my son was in Italy. Please examine him. He was in Italy. It doesn't mean that he has, every Italian or every Chinese has the coronavirus. And do you know how many other viruses there are? It's not one corona. And aside from that, do you know that coronavirus also exists in dogs and in animals and in humans? And you have enterovirus, you have the Coxsackie, you have... So, keep it rational. Even if somebody or you will know okay, has the coronavirus, okay, keep it rational. The biggest likelihood is going to be that he has a cold. Okay,
Right.
it's going to go away.
So, basic things.
And he's not going to be, let's say, infectious, as long as what they tell us from the CDC is true, the WHO, okay, the Center for Disease Control, etc. Okay, if the data is correct and if they're telling us what is going on, I have no reason to doubt them until now in my medical career, okay, then it's going to be something like a cold. But, okay, if it turns out to be something worse, you should question yourself what goes on with the other flu. Okay, with the common flu, do you think people don't die from the common flu? Of course they die, Saskia. Okay, especially older people, people with cardiopulmonary deficits, with diseases that, okay, if you have a...
Vulnerable groups.
Yeah, chronic disease and stuff like that. Okay, I mean...
So, don't worry about the masks, wash your hands, sneeze into your tissue, throw it away, and if you're not well, stay at home.
Yeah, but...
Until you feel better.
Exactly. Basic stuff. What would you do in a cold? Okay, even if you test positive.
Exactly.
Okay.
Right, yeah.
I mean, for example, I have a lot of friends in Barcelona. I used to live there for 2 years. And I saw that in the hospital I used to work, okay, hospital clinic in Barcelona, okay, there came a woman that was in Italy, because Italy, you know, it's very near. It's Spain, France, and Italy. It's only 5 hours away with a car. Okay, so basically there was a woman, and they said that we're keeping this woman in the hospital in isolation, not because she's sick, okay, but because it's only one person. But if there were more persons, okay, that were sick in a territory, they would be in, not house arrest, but in house confinement, okay, meaning that they will rest at home. I mean, if you're sick, you're going to stay home anyways, okay, and that's the basic thing. I mean, let me tell you something. I think we should be more concerned, for example, with HIV and hepatitis, which is thriving, okay, instead of the coronavirus. I mean, if we had the
measles,
same...
the resurgence of measles.
In 2007, I did a very big research on measles, but especially with HIV, okay, and a lot of sexually transmitted diseases. I think if we were so diligent, very good, let's say, in spreading the news as we spread the news for the coronavirus, we wouldn't have HIV anymore. I mean, isn't that crazy? We care more about something that is less deadly, okay, than HIV, for example, okay. Do you know, let me tell you something I want the viewers to listen, although I'm a paediatrician, but I used to do these things. When I was in Pedon, Hagia Sophia Children's Hospital in Athens, okay, we used to have 36 children that were HIV positive. They didn't have AIDS, they were HIV positive. We do disclosures and we treat them, blah, 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 blah. So, basically, do you know that there is also a post-prophylaxis regimen, and there is a pre-prophylaxis, PEP and PrEP. So, people now in the States can receive prophylaxis before they come into contact. But if you come into contact with somebody who is HIV positive, you don't know his status, you don't know his, whether he's infectious or not, you can receive up to 72 hours, a regimen that up to 98% is confident that will help you not to get the virus. Do you know that? Very few people know that there is PEP, post-exposure prophylaxis.
Yes.
Okay, so I think this is more important. Keep it short, keep it rational, be happy, because I want to come to you. When somebody is coughing, especially in the airplane, 2 people coughed in the airplane, okay, and actually somebody called the stewardess in order to get out of his seat, to change seats. So I think cough is going to make everybody feel guilty.
Right.
You know?
I could get 2 seats in the plane.
Yeah, for example. So cough away.
Thank you so much for being here today.
You look wonderful
to
today. I mean, you look wonderful. I want everybody to be happy. You know, life is short. Enjoy it. You never know. Let the coronavirus guide you to a better life and be happy about it. Okay? So don't care too much,
Thank
please.
you so much. I must say goodbye.
Goodbye? Already?
Bye.
Bye.
So, a very good afternoon, and I leave you in the capable hands of Rubinstein and Melody until Mariana's in the studio.